With regards to the effectiveness of the embryo transfer, and in terms of diet, there is nothing special that we should recommend or that we can recommend you. The reason is that with regards to the diet, you should not expect to have any short-term effects if you suddenly change what you eat or things like that. The effects of changing the diet may take place if you have been doing your homework for weeks or probably months before you start the treatment, and in some cases even are going to depend on what you've been doing during your whole life, you know. So there are, for example, studies that have been carried out in Sweden and in Netherlands that have confirmed that patients that were put on a diet to lose weight because they had high BMI didn't have better outcomes than the patients who underwent the treatments, you know. So it's not really clear if losing weight, for example, is something that can help, and we should be very careful about that, because the time that we need to lose that weight may even make things worse for the patients, dependent on their age. So if someone is 42, 43, what I would probably suggest is to start the IVF, freeze the eggs, and then if they want to lose weight, that's fine, but not invest in 6 months of losing 4, 5, 8 kilograms, because the quality of the eggs 6 months after could be really worse. So these are kind of things that should be taken into account, that must be assessed very carefully before we recommend something to the patients. So as I've said, not short-term effect on suddenly or on changes in your diet. There are things that you may be careful, because they can increase the risk of having infections like toxoplasmosis. So things like washing vegetables, fruits are really helpful, but that's it. Nothing that is going to make things easier for the embryo to implant.